Hi guys, I just wanted to hop on here and talk a little bit about Ozempic. It's been in the media recently, or social media recently, being used for weight loss, and kind of just wanted to talk about, whether this is necessarily an appropriate drug for that, and side effects, because it's just been swirling around social media recently. I think a lot of celebrities are using it, and so people are talking about it a lot more. So I just wanted to kind of hop on and say a little bit about it. It is technically an anti-hyperglycemic, which means it's used for only type 2 diabetes, to decrease your blood sugar. It is a GLP-1 receptor agonist. Basically, not to go like super deep into the pharmacology, but it helps your pancreas release more insulin, and helps the liver not release as much sugar, to keep blood sugar down. And so it was initially, only being used for that. And now most recently has been found to help with weight loss, which is helpful with especially type 2 diabetes. But now it seems that people are wanting a prescription for this for solely weight loss reasons, which I think that there is a place for this, but I think it's important to discuss side effects of this drug too, so that we know there's a little bit more conservative measures that probably should be used before this drug is sought after. So side effects of Ozempic, if your family has ever had any history of like medullary thyroid cancer, that's something that in animal studies Ozempic has been shown to potentially increase the risk for. It still needs to be studied more in humans, but if it were me, if I had a family history of that, I'd probably steer clear. Other side effects that can be major is acute kidney injury. It can cause some kidney issues. It's not released through the kidneys, so it doesn't have to be renally dosed, but that's one of the more major side effects. The other more major side effect is pancreatitis. That can be very severe, even deadly. That would be one where I would think that anybody that uses alcohol too, along with Ozempic, they're at even a higher risk for. So I'd be really careful with that. And speaking of alcohol use, if you're using that with Ozempic, alcohol can actually make the blood sugar after the person has drank dip lower. And so with use along with Ozempic, especially if you're using it and you're not diabetic, you can get really low blood sugars, which can also be very damaging. Less severe side effects, nausea, which could be part of the reason it's helping people lose weight. They're just not feeling as well. Diarrhea, just kind of some GI, more or less symptoms, reflux, like you can get like biliary stones as a side effect, tachycardia, feeling like your heart's racing. Now, this isn't to necessarily give this drug a bad name at all, because I use Ozempic in my patients that have type 2 diabetes mellitus. I like the drug. I think sometimes medicine gets a little bit, not scary, but it's when we are solely watching, or we see so much social media that if it's not coming strictly from a medical professional, I think some of these things that should be discussed, aren't necessarily, it just seems like a quick fix. Whereas I think, for weight loss especially, there are more conservative measures that definitely should be used first. And not, everything comes with side effects. Any drug comes with side effects, and some can be really serious. And I think that's something that we should discuss also in social media. So that's kind of why I wanted to put out this little video. And if you have any questions or comments, just comment below, and I'll try to get back to you guys, and maybe I'll try to make more videos. And if you have any other things that you want me to discuss, that would be awesome, and I can look at doing that as well. But I hope you all have a good day. Bye.